Okay, I hope you're all doing well. I'm Jibran, I'm a fifth year, and I will be discussing the CVP anatomy. Now, I hope you guys are studying well. I understand CVP is a hard block. It's very physiology focused, but there's some anatomy in it as well, and we'll discuss some of that, the pre-midterm stuff today. Overall, it's very interesting. It's a very interesting block. A lot of people, they enjoy it. And yeah, so I hope you guys do well in the exam, inshallah. It's gonna be easy, don't worry. Okay, just study well and do practice questions, lots of them. We'll do some today, but do some in your free time as well. I think your exam is tomorrow morning, so I guess you don't have enough any more time left. So these questions are from the University of Michigan website. If you search University of Michigan anatomy questions, you get these questions from there. Okay, and this is a source that Dr. Atif he recommended to us back in our first year. I don't know. I don't think he taught you these lectures though, but he did teach us these lectures in our first year. So I divided into the thorax and the heart because that's what you guys studied for now. So we'll start with the thorax. So here's the first question. I want you guys to read and then answer in the chat, and then we'll discuss it once you guys answer. Chat. B. Mashallah, you guys are smart, man. So yeah, the answer is B. Wait, let me just bring because this chat is like a small box.
We can unmute and answer.
What?
We can unmute and answer, right?
The what?
We can unmute and answer the question, right?
Write in the chat. Don't open your mics, okay? Okay, so the answer is B, sternal angle. So this is a very, very important topic. So if you see here, this is the sternal angle. This is also known as the medial-sternal joint, also known as the angle of Flouy. Okay. Basically, it is an anatomic landmark that forms at the second intercostal space. Okay, and this is very important when you're auscultating valves of the heart. This is how we do it. Like us fourth and fifth years, this is how we would auscultate. We auscultate the heart valves, like because you have to do them at certain locations. Actually, a question on that as well. So you go to the medial-sternal joint, and then you go to the right and left. So that's the second intercostal space, and then you count down. Okay. So, and another important thing, which your doctor mentioned in your lecture, is that at the level of the sternal angle, you have the bifurcation of the trachea here. Okay, this is another important thing she mentioned. So just know sternal angle, second intercostal space, and also known as angle of Flouy, and it's at the bifurcation of the trachea. Okay. So this is the second question. So yeah, the answer is A. I'm starting off with easy questions. I'm gonna increase the difficulty after some questions. So, yes, A is the answer. Basically, you have the neurovascular bundle under each rib, right? So you're supposed to basically palpate the rib and then insert it just above the rib, not below each rib. Because remember, intercostal arteries, they come directly from the aorta. Any artery that comes directly from the aorta, you can imagine how much pressure it's going to have. And it's actually a medical emergency. It's a big thing that happens. If someone punctures the intercostal artery, you need surgery to get involved. That's how big it is. So this is something very important, not just for now, but for later as well. They're going to ask you this in every year, basically. So here's the question on the vertebrae. Tubercle of the seventh rib articulates with which of the following structures? Transverse process of the vertebrae or the body of the vertebrae. Yeah. So the answer is E. So that it basically articulates with the transverse process. Okay. You don't need to know every single facet and demifacet, but two things that I recall that were important and I saw in your lecture as well is number one, the orientation of the ribs. So like if there's a seventh rib, then where's going to be the seventh vertebrae, above it or below it? And where exactly does the tubercle of the rib articulate where, like on the vertebrae? So this is another important thing. Let me show you the image. So this is an image from your lecture. So you can see here, yes. So this is a seventh rib. So T7 is going to be below it, okay, not above it. Okay, so for each rib, it's going to be below. All right, this is for the thoracic vertebrae. It did change. It's different for the cervical vertebrae. And you can see here, these are the transverse processes. Okay, and it's articulating with the tubercle of the rib. The tubercle of the rib, if you look at a rib, it's very prominent and it's very noticeable. And it's very important to know that the tubercle of the rib is with the transverse process of the vertebrae, and the head of the rib is with the body of the vertebrae. Okay, here. Here's the next question. This is related to the vasculature. Oh, okay, yeah, okay. Yeah, you're right. Do you guys have an answer? This is C. Any other answers? It is C, by the way. I confused you. So the answer is C. The answer is C. Uh, yeah, so basically, it's not D, it's C. So something important to know about the brachiocephalic vein and the renal vein. You'll study this later in your renal and your GI block, that they actually cross the midline. Okay, so you can see here, this is the left brachiocephalic vein. It crosses the midline and goes to the right because the superior vena cava and the inferior vena cava are on the right side, while the thoracic aorta and the abdominal aorta on the left side. Remember this. This is like you need to remember this rule for the chest and the abdomen. Okay. Now, same for the renal vein. It crosses across the midline and goes to the right. Okay, you don't need to know about the renal vein for now, but I'm just telling you, you're going to see this later on in this nice connection that you can make for these two structures to remember it better. Okay, so the left basic brachiocephalic, it crosses the midline, goes to the right to the superior vena cava. Okay. You guys have an answer or no? B. What else? Any other answers? Okay, so the answer is, it's not B. The answer is E. Yes. So the answer is E. Thoracic duct. The thoracic, I mean, you guys didn't study the mediastinum yet, okay? However, you guys did study the vasculature and the posterior mediastinum structures, okay? This is in your first lecture. So I didn't want to touch upon this at first because I didn't know this was in your lecture because I heard you guys didn't have mediastinum, but I added this just now. So the thoracic duct, it basically receives the lymphatics from the entire body, okay? Here's the thoracic duct. At the bottom, it's the Sitania chyli. Okay. And what's important here is that it is between the aorta and the azygous vein. Okay. Between the aorta and the azygous vein. Okay. Aorta, azygous vein. and it's behind the esophagus. So all these different structures are behind the, so esophagus would be like this. You can see this esophagus is going to be in front of the thoracic duct. Okay, that's why it says the surgeon lifted up, elevated the esophagus. What is the function of the thoracic duct? Like I mentioned, it takes lymphatics from the entire body, okay, and drains it to the where? To the subclavian here. Oh no, I showed you the answer. All right, then it should be easy then. You guys have an answer? Sorry about that. You guys have an answer? Wait, did you guys answer? No, you didn't. I need answers in the chat, please. No idea. Okay. So parts of the subclavian way artery is something that they love to ask about. Okay. A, E. So the answer is A. So you're right this time. So the parts of the subclavian artery, I don't know if because it was mentioned, I think, in one of your lectures. The subclavian artery has three important parts. Okay, you will also study this in your musculoskeletal block, because this is the artery that supplies the upper limb. Okay, but because this also comes in, because most of it is in the chest, that's why I'm discussing it here as well. And they love asking about this. So the subclavian artery has three parts. The first part is before the anterior scalene muscle here. The second part is behind the anterior scalene muscle, and the third part is between the anterior scalene muscle and the first rib. Okay. Now, in the first part of it, you have the vertebral artery, which goes up towards the midbrain. You have the thyrocervical trunk, which supplies the thyroid, and you have the internal thoracic, also known as the internal memory artery, which goes down. Okay. The costocervical trunk is behind the anterior scalene muscle. Okay, so it's part of the second part of the subclavian artery. Okay, so you have three parts. First part is before this anterior scalene muscle. It has these three arteries: vertebral artery, thyrocervical, internal thoracic. The second part has the costocervical trunk. It's behind the anterior scalene. And the third part, which is before the first rib, is the dorsoscapular artery. The dorsoscapular artery goes back. You're going to study this in your musculoskeletal block. But for now, you need to know this area, not this. Okay, this is in your MSK block. After the first rib, you have the axillary artery. This is part of your MSK block. Don't focus here. Focus here. Okay. So I guess we're done in most of the thorax. Please, if you guys have any specific questions regarding the thorax, you can write in the chat, or you can text me. I'll send. Or actually, I didn't mention my number here. Okay, I'll write my number here at the end. And you guys can text me if you want for any questions you have, okay? Or any advice in general that you want about first year or second year. So now we're going to start with the heart. This is a very high yield topic, okay? This question. You guys are studying, man, mashallah. So the answer is D. It's the right ventricle. The anterior surface of the heart is formed by the right ventricle, okay? This is very high yield. You will be asked about this everywhere, in steps as well. This came in my step 1 exam, by the way, that it's in the anterior part. So if you have a stab wound, if you have anything that penetrates anteriorly, it's going to affect the right ventricle, okay? The posterior most is the left atrium, by the way. Okay, and it's so posterior that you don't need to know this, but like I'm just telling you so you get oriented. right ventricle is anteriorly, left atrium is posteriorly. It's so it's so posterior that it's right in front of the esophagus, and if you have left atrial dilatation, it can actually squish the esophagus and cause compression. You don't need to know this. I'm just telling you so you understand the orientation, that the left atrium is the posterior most, right ventricle is the anterior most. And if you look at the heart structure, it's kind of hard. Like when I was in my first year, I didn't quite understand how the heart is oriented. Dr. Amen gave the example of a shoe. So he mentioned a shoe has a posterior surface, anterior surface, and an inferior surface. And that's probably the best example that you can have for how the heart is oriented, right? And it's pointing towards the left. It's not actually in the left side, it's pointing towards the left, but it is a midline structure, okay? And so you have an anterior surface, posterior, also known as the base of the heart, and the inferior surface. Inferior surface is mostly made up by the left ventricle, okay? And the posterior surface is by the left ventricle, a little bit of it, because the left ventricle is like this. It's like this, okay? So this is the inferior surface, and then some of the posterior surface. And then on top here, you have the atria, and then over here, you have the right ventricle. Oh, I could have explained it here. I forgot I added this picture. So you have right ventricle anterior most, right atrium, left ventricle at the back. And by the way, left ventricle is the one that forms the apex. This is very important, okay? So here's the posterior surface, and you can see the atria, and most of this is the inferior surface. You can see the left ventricle. Here's the next question. A, some people answered A. Whoa, you guys have different answers. Okay. What supplies the apex of the heart? This is very important. This came in my CVP exam. I can't forget it because I forgot it in the exam. So I understand, but it's very important. Okay. Yes, it's the LAD. Okay. So the anterior interventricular artery, also known as the LAD, is what supplies the apex. If you look here, here's the vasculature. You can see anterior interventricular artery growing and crossing the apex here. This is the apex, okay? Supplies most of the left ventricle. So if you guys want to read this, this is in the interventricular septum anteriorly. LAD marginal. So I'll go over the vasculature quickly because you need to know this. This is like one of the most important things. This comes in step 1 everywhere, okay? So you have the right and the left coronary arteries. The right coronary artery goes across, like just in front of the right atrium. It gives off 2 branches. It gives the right marginal artery here. This is at the margin of the heart, okay, on the right margin of the heart. That's how I remember it. And it curves back and forms the posterior interventricular, also known as the posterior descending artery, okay? In some cases, some anomalies, you can actually have the posterior interventricular, also known as the posterior descending artery, arising from the left coronary artery. This is just a point that you should know. Now here's the left coronary artery. It goes down, gives 2 branches, anterior interventricular artery and left circumflex artery. Okay. You also, if you go to like a more detailed anatomy book, you would find so many small like arteries and all. They're not high. Okay, you don't need to know that. You just need to know these important divisions. It's very easy. Each coronary artery has 2 divisions. Right one is right marginal and posterior descending. Left one is anterior descending and left margin. It's pretty straightforward. And also, circumflex artery, which gives the left marginal artery as well, but you don't need to know this, okay? This is the left marginal artery. It's on the left margin, and the circumflex artery goes like this, okay? Now, venous supply, wait, let me, because you know how like you have like the names, people? It's like covering my screen, so I'm moving it to the side. Please, if you guys have any questions, please let me know, okay? So now let's go to the veins. So what's important about the veins is that all of them, they drain into the coronary sinus, which is in the coronary sulcus at the back of the heart, okay? All of them, they drain here, and that drains directly into the right atrium, okay? And another important thing that you should know about this, and this is very, very high yield. This comes in step 1. This comes everywhere. Okay. And that is that the coronary sinus is where you have the most deoxygenated blood in the entire body. I'm not sure if this is important for your exam or not, but this is a very high yield point. And this is like one of those questions which you wouldn't expect anyone to ask, but they ask you these things. Okay. Pretty straightforward, simple question. Yeah, so it's A. So what you should know is during ventricular systole, oh, I didn't add an image for this. Okay. During ventricular systole, the ventricles, they're gonna contract. Where's the blood gonna go? It's gonna go to the aorta and the pulmonary artery. Okay. So the valves that actually are open during ventricular systole is the aortic and the pulmonary valves. Okay. Assalamu alaikum, doctor. How are you, doctor? Alhamdulillah. Is Dr. Atif pass? Okay. Okay, so and during ventricular diastole, when the ventricle relaxes, the valves that are open are the mitral and the tricuspid, which is when you have atrial systole. Okay, pretty straightforward, pretty simple question. I just put this in so you guys remember which one is which, because they all sound very similar, and I used to get confused a lot. The answer is E. Left, we call it parasternal. Okay, 4th and 5th intercostal space. This is very important. I remember trying to memorize this in first year, and I would forget it. And they asked questions about this, and I would get them wrong. And then in my 3rd year, they asked these as well, and I would get them wrong. The only time I actually remembered where these points are is when I did my first physical exam in a cardiac patient who had mitral stenosis. And when I did the examination on each of these parts. Now, how do you figure out where you are on the chest? Angle of Louis. So you palpate the sternal angle, okay? And then you go down from there, 2nd intercostal space, right and left. On the right side is the aortic valve. On the left side is the pulmonary valve. This is something that might confuse some people because the pulmonary valve comes from the right ventricle, but you hear it on the left side. And the aortic valve is in the left ventricle, but you hear it on the right side, okay? And then left sternal border, you have the tricuspid valve. All of these are sternal borders, by the way, except the mitral valve. Mitral valve is at the apex, 5th intercostal space, mid-clavicular line. Okay. You guys have an answer? D question mark? Could be. Think about where the coronary sulcus is, and based on that, see which arteries reach the coronary sulcus and which don't. The answer is the right marginal artery. Oh, I didn't add. Okay, I'll use the image from before. So if you remember, The coronary sulcus is at the posterior aspect of the heart. Okay, you can see it here. You can see the right marginal artery is not going to the coronary sulcus, which is in the posterior part of the heart. Okay, you can see the circumflex artery is going there. You can see the other arteries that you mentioned. Wait, so the right coronary artery, the left coronary artery, all of these end up in the posterior sulcus. Where did it go? Here. Okay, so the only one that doesn't is the right marginal artery. Do you guys get it? Okay, so that's it. I basically touched every topic, every important topic that you have in the thorax and in the heart. Okay, I took one topic from each, and then I explained the entire subtopic that specific topic or question is related to. Okay, I hope I didn't miss anything. Please, if you guys have any questions, please let me know right now. And if you don't, I will put my number here in the PowerPoint. Add my number here, and you guys can just text me. You know what? I'll send you guys the PowerPoint. Okay. So do you guys have any questions? Any questions? Because you guys have an exam tomorrow. I really hope you guys do well.